everyone, my name's Lynette Boerth from HardyGroup, and it's my great pleasure today to welcome Dr. Sean Taylor. Dr. Sean Taylor is the Deputy Director of Indigenous Leader and Engagement with the Menzies School of Health, and he's also the Executive Director of Aboriginal Health with Top End Health Services in the NT. Dr. Sean Taylor joins us today, and Sean, would you like to do our welcome to country for us?
Yes. Before we begin, I'd just like to acknowledge the traditional landowners on the lands that we're gathered today. Pay my respects to elders past, present and emerging.
So Sean is from Mer Island in the Torres Strait. He was a health worker on Mer Island in the early 90s before becoming one of the first of 3 nursing students to graduate from James Cook University Thursday Island campus in 2005. He's since worked as a nurse in Queensland, South Australia and in the Northern Territory. And he now has a graduate certificate in health in diabetes management and education from Flinders University. He's then gone on to study further with a Bachelor of Health Science Honours through the University of South Australia, and now is a Doctor of Public Health through the James Cook University, specialising in improving diabetes care and management in regional and remote healthcare settings. It's a great pleasure to talk to you, Sean, so thank you so much for joining us. And like I said, I've been wanting to chat to you for quite some time now because really your career has been in parallel with the Closing the Gap initiative. Graduated in 2005, around about the same time that initiative was released. And I'd really like to get your thoughts about how you feel the Closing the Gap initiative has made changes and improvements in health for Aboriginal and Torres Strait Islander people, but also your thoughts about what more can be done. Over to you, Sean.
Thanks, Lynette. Yes, the Closing the Gap initiative has been beneficial to many Aboriginal and Torres Strait Islander people across Australia. When we look at the report, it does demonstrate that we need a lot more work to improve health outcomes between Aboriginal and Torres Strait Islander people and non-Indigenous Australians. One of the things that I have seen is employment opportunities for Aboriginal and Torres Strait Islander people, and also the opportunity to go into universities and obtain scholarships, also career pathways for this population. Also looking at the health outcomes. I mean, that still needs a lot more improvement and understanding. So I guess as a staff member, yes, there's been improvements there. For the consumer, I think we still need a lot more work in this area.
So, and I can hear what you're saying. So, you feel there's been some great improvements from a workforce initiative for Aboriginal and Torres Strait Islander people. But the actual outcome as far as actually ensuring that there is no gap between non-Indigenous Australians and Indigenous Australians as far as health outcomes, it's clear that the data is saying that we're not there yet and we've still got some way to go. What do you think is the real barrier there to actually achieving those outcomes?
Well, I work in the Northern Territory and I spent a lot of time in the Greater Northern Australia, and language is one of the biggest issues. English is recognised as the preferred language to spoken in the health system. However, our patients don't speak English. So many of our remote communities speak a language that is to their region. However, understanding English is a barrier to many of our consumers. So when our consumers access the health service, they struggle to understand. And gaining interpreters, there are interpreter services that's available. However, they're not available to the clinicians when required, because many of our clinicians cannot understand. So now we're trying to get the interpreter for our patients, for our clinicians, so our clinician can understand the patient. So that's one element. 2 is the chronic disease. There's a number of chronic disease that still has a burden on the health system and a burden on our patients, or poorly managed chronic disease, I should say. And how do we address those, and what are some of the initiatives that we can do to address all of the high burden of chronic disease in our communities? Patient safety is always priority, and if a patient cannot understand then we're actually
going to
going.
give consent. Really,
Yes.
let's face it. If they don't actually understand, then they haven't given consent. So
Informed consent, exactly right. So
yeah.
And it's a struggle when you have people from diverse cultures who don't speak English, and so I think that's one of the things that the Australian health system needs to really reconsider the way we deliver things, because it's not a one size fits all.
And there's always that element of healthcare where there is that urgent, immediate response, because it's an acute episode and something needs to be done. But so much of it, like in chronic disease management, there is time.
Yes.
There is time. There is time to communicate. There is time to educate. And that education can start at a very early age, right the way through. If you've identified that someone's going to end up in renal failure or end up on dialysis, for example, you've got time, but yet we still seem to only address it at that acute phase rather than along the journey.
When I looked at my health literacy, my honours degree, it was the association between health literacy and glycemic control. And I hypothesised that poor health literacy contributed to poor glycemic control with my patients. But when I used the tool, the TOFLA, the Test of Functional Health Literacy in Adults, the patient said to me, "Sean, we know how to read the appointment. We know how to take those medications. But why? Why am I doing this?"
Yeah.
It's the why behind the why. And, so from then I've learned that, we really got to fully explain to our patients. And sometimes if you're a busy clinician, you send it to the appropriate health professional who can.
And that's where people like nurse practitioners can play such an important role in that.
Exactly.
That time and that education to actually ensure that people are understanding. And I don't think it's just Aboriginal and Torres Strait Islander people, it's all of us, even those that speak the language, to actually absorb information, particularly when it comes to your health, when there's a stressor involved with that as it is. You're going to have to hear the information more than once. You're going to have time to absorb it and read it. And
I had the opportunity No, I agree. I had the opportunity whilst I was on my Doctor of Public Health to go to America and spend some time with some psychologists in the Behavioral Diabetes Institute in San Diego. And one of the things that I really learned from over there was there's a conference that they hold, and it's called Taking Control of Your Diabetes. And it's where patients and clinicians come together and they both go on a journey. There's a number of sessions for the patient, and there's a number of sessions for the health professional, but at the end of the day they come together, and the idea is they have a panel of consumers or patients sitting at the front, and they ask them about the health professional, and the consumers or the patients floor the health professionals and say, the health professional don't have the time to explain things to me. They give me unrealistic goals. They do X, Y, and Z. Then you get the health professionals up and they say the patients are non-compliant. They don't turn up for their appointments. They don't do X, Y, Z. And you hear it all across the world, regardless of. And like you said, it's not just Aboriginal and Torres Strait Islander. It's everybody.
It's all of us. It's all of us. Exactly. What do you think? I mean, language is obviously a big barrier, as you've sort of indicated. There's also an element of history there and trust in the healthcare system. And so my experience has been obviously in the dialysis field for many, many years. And establishing trust between the healthcare provider and the patient goes a long way to actually achieving success. How do you think we can build that trust moving forward?
Communication. I'm going to bring it all back to communication. Communicating with our patients, and including our patients in the journey, in their journey, I should say, through the health system, and navigating them through the health system so that they can understand and feel comfortable going through the service, and ensuring that we get informed consent, and ensuring that the patient fully understands what they're actually consenting to. So at the end of the day, having a better communication between the patient and the health professional and in guiding them through the journey, I would strongly suggest.
Mm-hmm. We've also seen, I guess, some recent initiatives occur, obviously with the National Safety Quality Standards. We're now starting to see some, important changes being made where we actually address things like that we should be on admission, recognising whether or not someone that is joining a healthcare service that is Aboriginal or Torres Strait Islander, that identification process, and a number of other initiatives as well. Do you think that this will have an impact, that this will play a part moving forward?
Yes, I agree. I think the National Safety and Quality Standards has a huge impact on our patients' care in ensuring that our hospitals and health services are practicing according to these standards and meets the accreditation needs, and for the best of all our patients across the diverse populations.
Mm-hmm. And I guess the other thing that I'm really pleased to see too is the initiative such as what's happened just recently in Queensland, where it's been passed that health boards now, hospitals, health services and boards should have Aboriginal and Torres Strait Islander representation. Do you think this will also have an impact?
Yes, I mean, including Aboriginal and Torres Strait Islander people in the decision making is imperative. They represent their communities, they represent the views of the communities. It's not a one-size-fits-all for any population. So you need to have the diverse representatives that sit around the table and ensuring that they advocate for the best needs of the consumers that we are serving. There's engaging consumers at all levels. If we look at Standard 2, there's a number of key elements that all hospital and health services need to address. And one of them is ensuring how do we engage with our consumers, but mostly in Standard 1, it's around how do we address the needs of Aboriginal and Torres Strait Islander peoples. So that voice that sits at that table would voice those concerns and those issues. If
you had 10 minutes with every CEO of every health service around Australia, just to sit and chat with them, have a yarn, what is it that you think you would want them to know?
One of the things I would strongly advocate for is better communication across all levels and fully engaging the patient in the journey. I cannot strongly emphasize this, and this is one of the things that I've really learned in this position, is communication between the health professional, or improved communication between the health professional and the patient of diverse backgrounds, and especially those patients. English is a second language, and we all know the sum of human knowledge is not contained in any one language. So that's because a patient doesn't speak English doesn't mean they are uneducated. They just don't understand the language. So if we can really embrace that there are many languages that are across Australia, and we need to ensure that we can communicate effectively to those patients so we can achieve best outcomes for them.
That's great, Sean. Thank you. And I just want to touch really quickly, if we may, a little bit on our younger generation, our younger people in particular, because I think this is all about understanding, being collaborative, being inclusive, and what is it that we need to ensure our younger generation understands and knows as far as Australia is concerned, the indigenous population, as far as what we should be doing to ensure that everyone has good health outcomes. Do you think it really starts with the younger people and the younger generation to actually ensure that they receive the education that they need, that health knowledge as well?
Yes, no, I agree. It all starts with our young, always starts with the mums and bubs, and that life cycle and that journey that the child has, and understanding that education is the key, and ensuring they have good positive role models around them, and to ensure that they can look up to somebody and have a pathway that they can look and say, I want to aspire to that person, I want to aspire to that person. And, you know, and I think that sometimes lacks in many Indigenous communities or Aboriginal and Torres Strait Islander communities is the lack of role models and people going into career pathways outside of their own normal education system. So each, you know, the Aboriginal and Torres Strait Islander population has an education system that's been around for a very long time. However, moving into a mainstream education system and then working towards jobs that can benefit their communities and their or their families and friends that are around them, and inspiring to a career that can be worldwide. The other world is your oyster.
Like you. Who inspired you when you were younger, Sean?
So I was inspired by many of my father, my grandfather, many of my uncles. You know, they taught me a lot of things, and I didn't have any of my uncles in health, but I was very, I must admit, the most of the career and in health was mostly driven by the female, you know, my aunts and my mum and my, you know, that all inspired me to go where I wanted, that caring nature.
Well, thank you so much for joining us today, Sean. It's just a small chat today, but it's a very important one, and it's been an absolute pleasure. So thank you so much.
Thank you. Thank you for the opportunity to speak.
Thank you.